Përshëndetje shikues të nderuar, mirë se erdhët në emisionin Pasqyra shëndetit. Do të jemi sot duke folur për dy nga specialitetet më të rëndësishme, siç janë radioterapia dhe onkologjia, për të trajtuar një sëmundje të rrezikshme për shëndetin e njeriu, siç është kanceri. Do kemi të ftuar dy mysafir, të cilët na vijnë nga Turqia dhe nga spitali, një ndër spitalet më të mira në rajon që kemi, do të thosha, Axhibadem Maslak. Me ne sot është Dr. Enis Ozjar, welcome to our TV show, and Professor Dr. Ozlem Er, welcome.
Thank you, hello.
It's nice to have you here today.
Thank you so much.
I will start with Dr. Enis Ozjar. Can you tell us which types of diseases could be treated with radiotherapy?
Actually, radiotherapy is used mostly in cancer patients, and 99% of our patients are cancer patients, but very rarely we use in some non-cancer patients, benign diseases, but this is very rare. So we mainly treat cancer patients, and we are treating almost all cancers in the body, from brain tumors to extremity sarcomas, from pancreas cancer to prostate cancer. So in most of the cancers, radiotherapy has a role.
I believe a main role.
But it doesn't mean that all patients will receive radiotherapy, but we know that all cancer patients, almost 50%, receive radiotherapy in some part of their treatment.
Can you tell us which devices or technologies is Axhibadem Health Group using?
Yeah, in radiotherapy there are different machines, but generally we are using linear accelerators. These are very high technology machines. From a distance, we are treating the patients. Usually patients lie on a table, and from about 1 meter distance, we treat them with radiotherapy. And this radiation doesn't stay on the body of the patient. So we just give the radiation, and it makes the effect, and it disappears. So the patient doesn't carry on a radiation on their body. And there is another radiotherapy kind, which is brachytherapy. Brachytherapy means internal radiation. Sometimes we put some applicators in the body, and we connect a special device, and we send the radioactive source into the body. We treat them, and we take out when we finish the treatment. And there are also some devices. These are very specific devices. These are called stereotactic machines, like CyberKnife or V-ray machines or MR-guided radiotherapy. These machines are used for stereotactic treatments, and these patients constitutes about 10% of all cancer patients.
You mentioned CyberKnife. Can you tell us a little more what is CyberKnife?
Actually, CyberKnife is a linear accelerator, but it's a robotic device. Normally in car factories, in the industry, there are several robots working. So the importance of robot is these robots are making these treatments very precise. So its precisity is less than 1 millimeter. So because of that, there is a linear accelerator, which is a small machine on the top of the robot. They put this machine on the top of the robot, and robot gives the radiation from different points. So this is the main difference of CyberKnife from other machines. And CyberKnife is also different than Gamma Knife, because Gamma Knife is only used for brain tumors, and you cannot use it other than brain. But CyberKnife can be used both in brain and also in the body. So we can treat whole body with CyberKnife treatments.
A lot of advantages I see
Yes,
here.
yes.
Is this the main difference between radiotherapy and radiosurgery?
Some machines are also used for radiosurgery, but the most important one is CyberKnife. It's a dedicated device. And also V-ray machine, which is MR-guided radiotherapy, can be used as a stereotactic radiotherapy machine, but it can also be used as a conventional linear accelerator.
What is MR, guided radiotherapy, and what's the main difference between this system and conventional radiotherapy?
Conventional radiotherapy, we need imaging. So, because why we are using imaging, we have to see where we are treating. So we usually use X-ray based systems, like, it's like conventional X-ray or tomography. We obtain these images. But recently, they made a new device, and they implemented the MRI inside the linear accelerator. So this is a very new technology, and we started to use since 1 year. So the advantage of MRI is in some areas it's difficult to see the tumor or the critical structures around with conventional X-ray based imaging systems. So MRI shows us very well these tumors in the body. For example, the main advantage comes to the tumors in the liver, pancreatic tumors, prostate cancers, and abdominal and pelvic tumors. Because when we make MRI, we can very well see these lesions, because to treat a patient, you have to see the tumor. If you don't see the tumor, you cannot treat a patient. And the other advantage is these machines have a very fast treatment planning system. In classical radiotherapy, we do a first day planning and treat all the day patient with the same plan. But with this machine, we get the anatomy of the day, we see the anatomy of the day, because sometimes tumors are changing their shape or they shrink, and also the normal structures, normal organs can move or push the tumor. So with this MR-guided radiotherapy, each day we delineate where is the tumor, where is the normal structures, we make a new plan, and if the new plan is better than first day plan, then we treat the patient with new plan. So this is the main advantage. So, which means we have a better local control, so we can treat the patient, tumor very well, and also we can protect the critical structures, so patients has less side effects. So this is the main advantage.
What are the main differences between Axhibadem Health Group and other healthcare facilities for radiotherapy?
First of all, we are the largest private health group in Turkey, and we have 8 centers, and only 8 centers with radiotherapy. And in these 8 centers, we have 20 linear accelerators with very high technology machines. And also we have different facilities like CyberKnife, Gamma Knife, V-Ray, intraoperative radiotherapy. So we have all spectrum of machines which we should use in our patients. So we can reach these technologies in one center, because most of the other hospitals, they have some machines, but they don't have all kind of machines. So they cannot treat all spectrum of cancer. So this is the main advantage. And the other thing is we are using in a multidisciplinary approach. So we are always talking with our colleagues from medical oncology, with the surgeons. So we always discuss with the patients, and we decide the best treatment for the patient.
All I could see is that the patients who should choose Axhibadem Health Group because it's the best for their treatment.
Yes.
Okay, do you want to add something more for the end? Like, what do you want to say to all of the patients that maybe are watching in this moment?
Actually, when the cancer diagnosed, the first treatment is very important. I mean, if you don't have a good treatment, if you have a radiotherapy which is not a good quality, you don't usually have a second chance. So patients should be very cautious while choosing their treatment, because if you receive a radiotherapy and which is not successful, the second radiotherapy is quite difficult, and it's difficult to treat the patient. So I suggest the patients to decide treatment in the beginning. I mean, because when it recurred, when the tumor comes again, it's always difficult to treat and difficult to have a good result.
Of course. Dr. Enis Ozjar, thank you for being here today.
Thank you so much.
It was a pleasure. Shikues të nderuar, do shkëputemi për pak çast të publicitet dhe rikthehemi në pjesën e dytë për të folur pak më shumë për onkologjinë. Jemi rikthyer në pjesën e dytë të emisionit dhe në këtë pjesë të dytë do të jemi me një doktoresh nga departamenti i onkologjisë, e cila është doktoresha Ozlem Er. Hoş geldin.
Thank you.
Doctor, can you tell us which kind of conditions do you treat?
Okay, I'm a medical oncologist, and medical oncology deals with all kind of solid tumors. If you want to name that, they are, breast cancer, lung cancer, stomach cancer, colorectal cancer. These are all cancers found in males and females. Cancer is actually a global problem, and it's very common in the world. We see that almost 18 million new cases are diagnosed all over the world, and also in Macedonia, in Turkey, we see many cancer cases. So, breast cancer is the most common cancer in females, and I treat the breast cancer, namely in females, and also lung cancer is common in men and also in women. It is very important to treat again, but the most important thing is in cancer is the early diagnosis. So we recommend all people to be checked up, for regular follow-ups and to be diagnosed as early as possible. So then the treatment success is higher.
But what are the exact steps we should take if we have a cancer history in our family?
Okay. If a cancer is present in the family, maybe in your parents or in your grandparents, uncles, whatever is the case, first of all, you should know what type of cancer is present in the family and at what age the person had the cancer, because if it's in younger ages, then it is more important. Especially breast and ovarian cancers, they run in the families. Again, colorectal cancer, large intestine cancers, they also run in the families. These kind of cancers are not more than 10% of all cancer cases, but it is very important because it occurs in younger ages and it occurs in the more than one member of the family. So if there is a member in the family that has breast cancer, maybe at 30 years old, very young age, and then they should be tested for genetic changes in the blood, and if it is present, then the other members of the family, the sisters, brothers, not only the females actually, because if there is one gene present, then it can be transmitted also to men and women. We test for this gene, and if it is present, then without developing the cancer, it can be prevented. So it is very important.
If it's in early stages, I believe.
Even before the early stages, if it is present in your genes, then it is tested, you are positive, then maybe for prevention you can get some medication or you can have some early surgeries before developing cancer.
So all we should do is to go for these follow-ups?
Yes, correct.
Okay. What is the treatment philosophy or targeted therapy in cancer? Can you tell us a little more about this?
Yeah. In cancer, the systemic treatment actually consists of chemotherapy, targeted treatment, immunotherapy. Chemotherapy is the first treatment that we use for more than 50 years. It targets the dividing cells, the chemotherapy. But in targeted treatment, we search for specific characteristics of the tumor cells. There may be some protein receptors on the cells, or inside the cell there might be some genetic changes. It is detected by some techniques, and then according to the presence of these proteins, some drugs are developed. This is called targeted treatment. So it's very specific to the tumor cell. And when you use this treatment for the tumor, then the side effects are less and the activity is higher for the tumor. So the tumor gets shrinked or disappears sometimes. It disappears and it lasts longer. And most of these targeted treatments are either pills taken orally or intravenous taken through the veins. So if it is pills, then it's like treating a hypertension or diabetes. You know, you
Yes.
have your drugs in your bag and you go home and you get the treatment, and regularly you go for, you know, blood checks and some kind of side effect controls to the doctor.
Okay, so this, the other drugs are the smart drugs that you use for this kind of therapy.
Yeah, the targeted drugs, targeted treatment is also called smart drugs in the, you know, newspapers or magazines, but they are really smart because they find the tumor cells and they destroy these cells in the body without destroying the normal cells.
So you're using these kind of drugs for treating patients?
Yes, we are using this kind of treatment maybe more than 10 years for specific type of cancers, especially lung cancer, breast cancer, again stomach cancers or colon cancers, some kind of sarcomas. These are called soft tissue tumors, which are very rare but very aggressive type of tumors. So we check, actually we should tell this also, in the old times we were saying that there is one treatment for each kind of cancer, but now we are saying that for each type of cancer and for each patient there is a treatment. So it's called personalized treatment, which is very specific for the patient and the tumor.
Doctor, what is immunotherapy? Is it possible to use immunotherapy for every patient?
Immunotherapy is another kind of treatment that is used for cancer. And in immunotherapy, we use the own immune system of the patient to destroy the tumor cells, because we know that the tumor cells are actually the cells of the patient. They are not, coming from outside. It's not like viruses or parasites. They are the cells of the patient. But they are growing rapidly and in an inordered way. There is no organization. It is disorganized growing. So they make masses in the body. It can be in the breast, it can be in the lung, but it's called then breast cancer or lung cancer. In immunotherapy, we use the immune cells, the T cells that are attacking the foreign bodies in the body of the patient. So these cells go to the tumor cell and they attack directly to the tumor cell. So what's the difference between, chemotherapy, immunotherapy, and targeted therapy? In immunotherapy, we are destroying the tumor cells in an indirect way. We are telling the immune cells to go and destroy the tumor cells. Okay. In chemotherapy, it is going directly to the tumor cell and it is destroying the dividing cell. But at that time, you have normal cells in the body dividing, like, the cells in the mouth, in the esophagus, in the gastrointestinal system, also hair, they are all dividing cells. So also chemotherapy destroys these cells. So, for example, you have hair loss in chemotherapy, but in immunotherapy and targeted treatment, you don't have hair loss, because it's not targeting the normal cell, it's only targeting the tumor cell.
So I believe every patient is asking you which one of these is the best one.
Yeah, this is another good question, because sometimes we use combination of these drugs and sometimes we use only one type of treatment. It depends on the tumor and it depends on the patient. There is no one treatment that is good for each tumor type. So we need to choose the best for the specific patient. This is very important because precision oncology helps us to save lives and to extend the lives.
Okay, that's very good. What makes the difference between the oncology centers from all over the world? What is the main advantages Axhibadem has?
In Axhibadem Healthcare Group, we use, most current treatment strategies for our patients, namely, as we talked, immunotherapy, targeted treatment, or chemotherapy, which will suit for the specific tumor type. And also, we do this in a multidisciplinary setting because the success rate comes from comprehensive cancer centers. And comprehensive cancer center means actually having the ability to treat all cancer types in an experienced way and with the more recent technology. So we combine our knowledge, experience, and technology in one setting, and I think this is our advantage for treating the patients.
Okay. Would you like to add any more advices for all the patients that maybe are watching us?
Yeah, actually, I'd like to advise that for all the patients and also for all the healthy people, most important thing is to be, for example, first of all, to be diagnosed properly, because if the diagnosis is correct, then the treatment comes after that. And also prevention is very important. So we know that everybody asks us, what can I do not to get cancer, right?
Yeah.
Smoking, this is number one
reason.
cancer reason. Again, exercising is important, regular exercising and healthy diet. And this doesn't mean that eating very specific things, but eating everything, all fruits and vegetables in a balanced way and keeping the ideal weight. This is another point. And alcohol, it should be less or, moderate. Limited. And the fifth thing is the sun. The sun is very good for vitamin D, for bone health, for our health. But if it is above 15 minutes a day, then it also causes skin cancer. So we should be careful for this. Other than that, our family history, it is very important, and to do regular checkups.
Yeah, but I believe every patient is not listening to these advices, and we want to have, we don't want to get sick, and we don't want to eat unhealthy. Right. That's the main problem.
Yeah, we should remind every time we should remind about healthy style of living. But if you are having a cancer or disease, this is not the end of the life. Cancer is a treatable disease, and we should tell that it's a chronic disease. It's like, other diseases. So sometimes they also don't want to come to hospital because there is no, treatment option. Or maybe sometimes it happens, elderly people don't have the chance to be treated. This is not correct. Even for elderly people, we have treatment options because side effects are less, and we have more options like immunotherapy, targeted treatment, or combination of radiotherapy and chemotherapy, which are more, better for the patient. So every patient has the right to be treated.
Yes, and for the best treatment, I believe everyone should choose Axhibadem. Okay. Thank you for being here with me today. It was a real pleasure.
Thank you. It's our pleasure.
Shikues të nderuar, ne me kaq përmbyllim emisionin për sot. Faleminderit që ishit me ne. Bashkëdërisht jemi nesër. Deri atëherë, mirupafshim.